Hello, my name is Rachel. I'm from physical therapy, and we're going to talk today about some exercises that you can do preoperatively just to prepare you for your upcoming surgery. With the incision that you're going to have, we're going to ask you to do a lot of things without using your arms. It's very helpful if you have your strength in your legs is as strong as possible coming into surgery. So just some really basic things you can start with are just doing ankle pumps, and you can just rock heels to toes right off the floor, nice and slow. We tend to want to do these too fast. Good job. If you have your legs elevated, you can just pump your feet up and down, nice and slow. Very good. For your thighs, your quad muscles, you can do slow kicks. Just straighten your knees, straight as you can. Slowly lower it back down. Yep. Perfect. Nice and controlled motions. These are the muscles that we really count on to go from sitting to standing. So it's very helpful if we can strengthen these muscles prior to surgery to make things easier for you to move around within your precautions. And then for the hip muscles, just marching in place. Nice and controlled. Very good. We want you to pace yourself as tolerated. So if this is the most that you can do, just stay seated. We can also, if you're doing okay, you can tolerate more exercise. We can then move to some standing exercises. So I'll have you hold on. You want to find a surface that's about the level where you don't have to bend over, where you can stand nice and tall. Once you find a safe place to perform the standing exercises, one you can try is just raising up on your toes and coming back down, nice and controlled. And make sure you're breathing through the exercise. We tend to hold our breath. Good job. In through the nose, out through the mouth. Okay? Another one, working on our leg muscles. We can squat down, just mini squats. Only squat down as far as you can easily stand back up. So far, okay? Yep. All right. Another one we can try is just marching in place. Mm-hmm. And you can do low marches. They don't have to be high marches. Just enough to shift your weight from one foot to the other. Good. So are you doing okay right now?
I am.
Okay. So we're going to do some kicks forward. It's going to work on your hip muscles. Good. Perfect. Then you can kick out to the side. And then you can kick backward, trying to keep your back nice and straight. Good job. The precautions that you're going to have with this surgery, again, is not using your arms. So we're going to ask you to hold a blanket or a pillow across your chest, or just fold your arms over your chest. And it's very helpful if you practice sitting to standing without using your arms, okay? So, yep, you want to lean forward. Good job. Something else we tend to do is hold our breath as we stand up. So if you can make a habit of breathing in and then blow out as you stand up. And then you can sit back down. Very nice. This is about pacing yourself. So if you want to increase, try to push your endurance a little bit, you can do a set of exercises. You can do a few repetitions, but stop when you feel winded. or you feel like you just need a break.
Okay.
Okay? The number of repetitions, you can do, 2 to 5 repetitions. You could go up to a set of 10. It's going to depend on what your tolerance is. It's really going to be based on how much mobility, how much you're moving around leading up to surgery. Because if you're very fatigued, very tired, you may not have a lot of reserve to do a lot of exercise in addition to just going through your normal daily routine.